Hello, class. As we approach the end of chapter 10, dealing with community and public health and racial ethnic populations, one of the things that I've seen or that you see throughout the chapter is the influence of culture on the various ethnic groups as to how they experience health outcomes and their belief system towards health outcomes, and in other aspects dealing with some of these racial attitudes. So the value of culture is very, very important in dealing or interacting with people for a meaningful outcomes. Cultural competence is very, very important because people's behavior through life is highly influenced by their culture. Yeah, people are able to move from one set of culture to another, but at the end of the day, most of the time, they end up going to their original culture. You have people, okay, go to the office, speak English, do everything as the work culture demands. But when they go home, most of the time, they go back to their native languages, the food they eat is from their culture, and some of the behaviors they exhibit is also influenced by their culture. So, as a country like America that is multicultural, public health has a big challenge in trying to make sure that everybody within America, to a greater extent, is understood so that whatever service is intended to be provided for them is understood and they are meaningfully engaged either through their own language or somebody who is going to interpret so that they understand what service is to be provided, who is going to provide the service, when, where, and how. You see, because most of the time when people don't understand other cultures, then they revert to stereotypes. And stereotypes most of the time are one of the most difficult or toxic attitudes that people can inject into a normal conversation or a normal interaction with one another. So, cultural competence is a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals that enables effective work in cross-cultural situations. Culture is virtual. Culture is vital in how community health professionals deliver services, and how community members respond to programs and interventions. So culture is very, very important, very important in how community health professionals deliver services and how community members respond to programs and interventions. And to enhance some of these things, there is a cultural kind of culture. People has to be culturally and linguistically appropriate services standards have to be established for us to really be able to engage each other to provide effective services. We have to be culturally and linguistically appropriate services standard, say class. C for culturally and linguistically, L appropriate, S appropriate, A and service standard. They came up with this standards so that when you're dealing with culture with multicultural people, these are the key things that you have to try as best as possible to really understand. You have to have certain standards, and these standards are culturally and linguistically appropriate, so that when you engage these people, the interaction can be meaningful. People understand each other. People try to trust each other. And people are much more likely to be open to each other, so that the professional, the health professional can be able to provide services that members of the community that might be that might be of different cultures can be able to respond appropriately to programs and interventions provided. Health professionals have to be competent in these areas. First of all, the principal standard should be able to provide effective, equitable, understandable, and respectful quality care and service that are responsive to diverse cultural health beliefs and practice preferred languages, health literacy, and other communication needs. You don't go there with the assumption that, well, they need it, therefore they will be responsive to it. Most of the time, that's the mistake at times we make, because there's always an element of what we don't know. Most of the time we don't trust. And unless we're able, the community, the diverse community is able to understand what service is going to be provided, who is going to provide those services, most of the time, there is the possibility for a lukewarm response to programs and interventions. That's why people have to be understood, and the service have to be really very important. You provide effective, equitably understandable, and respectful quality care and service that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So health professionals have to be competent in some of these areas. If they cannot, they have to learn some of these things or use people that can help to negotiate, to translate, so that people understand each other. For governance, leadership, and workplace, there has to be, it has to advance and sustain organizational governance and leadership that promote culturally, linguistically appropriate services standards and health equity through policy practices and allocated resources. You have to develop those policies. You have to make sure that policies that are created in a way wherein people can really understand each other. It's a two-way. Teach those people also, those diverse cultures about, say, if it comes to teaching them English, they should be able to speak English and understand English at least at the functional level. And at times also depending on different settings, you have to have somebody who understand the people. Say, for instance, you want to develop a program for recent immigrants from other countries, refugees. Most of the time, you need translators who can explain to them what sort of programs have been developed for them, what sort of interventions, so that they can understand and be engaged in the program development or the intervention, so that they can benefit from it. And at times, again, you try as best as possible not to put down their behaviors or say, oh, they are primitive, they are this. But most of the time, understands, reach them where they are and try to bring them to where you want them to be. It's not a matter of trying to classify their behavior, because most of the time we have that kind of tendency to think of other cultures as being primitive. No, there's no primitive culture. That's the culture of those individuals. That's the way they live their lives. And you have to understand that and explain to them how At times, there are other options, and get to the point wherein you are and you, the health professional, and the intended population are in common understanding of what needs to be done to benefit from the program or the intervention. Certain attitudes, all of those there are different challenges in different cultures with different attitudes. So those attitudes also have to be addressed, because if those things are not really properly understood, most of the time the health outcomes will not be as effective as intended. That's why it's very, very important for leadership to create policies and allocate resources to educate different groups as to certain issues, either be it health-related issues or behavioral issues that impact their health negatively. So governments have to recruit, promote, and support culturally and linguistically diverse governance. Leadership and workplace that are diverse governance also develop a culture wherein the workplace that are responsive to the population in the service area. So we have to understand each other, the bottom line. See, there are certain times, even right now, even though America has opened her hands to so many cultures, it has its advantage because of multiple talents, because of multiple, diversity, but also has some challenges, because most of the time, I don't think people really understand each other. And when it comes to health related issues, health professionals have to really go the extra mile to understand the culture of their client or of the community that they serve. Because when they do that, there is a better way that will encourage effective engagement. And when people are engaged in the program that are offered for them and interventions, the outcome is usually much better. You have to educate and train governance, leadership, and workforce in culturally and linguistically effective manners, and develop appropriate policies and practices on an ongoing basis. You see, culturally and linguistically, and also develop appropriate policies. Policies that is aimed at providing effective service to all groups of different groups. Policies that does away with biases. Policies that does away with stereotypes. And the main aim of a health professional is to provide appropriate services that will ensure successful health outcomes. When it comes to communication and language assistance, again, it's very, very important. If people don't understand each other, we make assumptions. And it might appear as, oh, this is just simple. No, it's not. When people understand each other, they will ask appropriate questions and they will do what is intended for them to do. So therefore, communication has to be paramount. There has to be language assistance. If you realize that these people cannot speak English and you are an English speaker, maybe try to get somebody who is somebody who can speak the language of the group you want to assist. Let them be the kind of the go-between so that they can translate, so that they can understand, so that they stop making assumptions. Oh, he was saying this, while in reality, he was not saying something even close to what you think he was saying. He said, because some people can really try to speak English does not mean when it comes to health related issues, they really understand some of the vital, some of the things that you are really talking about. You need somebody who can help you, who can be a go-between, a translator, so that you don't waste time and resources simply because of lack of understanding of each other. So this is especially true for people who are limited English, they have limited English proficiency or other communication need. Let it be no cost to them. It's just to help them so that they can meaningfully engage in the services that is offered. So this has to be a continuous improvement, continuous engagement. And yes, there has to be also a level of accountability. Because if you say you're going to provide these services and you've done all that you can, people have to be accountable. Because regardless of whatever we do, there's always a limit. You have to make sure that, okay, those Those people with limited English proficiency should try as best as possible also to learn, to understand, because it will not only affect their health, but also their ability to be able to function effectively in society. English is their primary language, and diverse people, diverse populations should try as best as possible to also try to understand, to be functionally literate in, in English, so that they can be able to function appropriately within the society in which they live. Well, by and large, cultural competency is extremely important. Most of the time, it's not only for people who are limited in English, but also even people who are very proficient in English, who still live their everyday life in this dual culture. One, cross-cultural situations wherein they go to work proficient in English and but when they come back, they have certain behaviors within their culture, certain attitudes in their culture that are not helpful for them to maintain good health. So these are things also that at times when we discuss some of these things, it goes two ways. People also have to know within their cultures what are some of these things or attitudes that we deal with in terms of the way we behave, in terms of the food we eat, that in some cases are not as helpful to our health. And what can we do about it? Empowering the self and the community to enable people to solve their community health problems. You have three kinds of power associated with empowerment. You have the social access to basis needed to gain political power. Usually this is very, very important. When you gain political power, you have access or you have the ability to be part of the policy that is developed, that is going to impact your community. So it's extremely important to be politically engaged, so that when power and when those in power develop policies, you are there to seek the interests of your respective community. You have the political power of voice and collective action. There's always power in number. Now, as you can see, most of the time, when people are political, they raise their concerns, they raise their interest. They share their concerns with politicians, or they become political themselves. Policies are developed that eventually will help those communities, those diverse communities. And right now, America is going through some of those situations wherein different diverse communities are now in Congress and the Senate. And some of those diverse communities or those diverse politicians are raising issues affecting their respective communities. And some of those concerns are being addressed because they have gotten themselves engaged, they've become political, and there's always the saying, if you want your issue to be addressed, you have to be involved in developing policies for that issue to be involved and to be addressed. You have to be engaged. You have to start at the grassroots level so that people know what are your issues and how you intend to address those issues. Because if not, most of the time, it's very, very difficult for people to just, oh, I think this. Yeah, you think, but most of the time you don't get those kind of things. You have the psychological, the individual sense of potency, the individual sense of power, self-efficacy, the individual's ability to advocate for their own interest. So these are all things that as we discuss about community and public health and racial ethnic populations, most of the time we run into so much confusion. And most of the confusion, to a greater extent, people don't understand each other. And sadly enough, people don't take time to understand each other. And people tend to operate on stereotypes. And most of the time, the stereotypes, are very, very, well, discouraging for those people that are directed with these stereotypes. The best thing is we have to, as a nation, it's not only for health education, health professionals, but for all professions, to really take time to be proficient in different cultures. We should all make the attempt, the effort to be proficient in different cultures, so that when we interact, when we engage with different cultures, we are all singing from the same page. So that whatever is decided or whatever policy is developed, that policy is going to be helpful to those populations, those groups. That policy will be acceptable because they understand the policy because they feel respected. It's because, again, most of the time is just because people don't have certain things do not mean that they have lost their sense of dignity. People want to be assisted, but at the same time also want to be respected as human beings. And that can only happen when those people providing the service understand that we have all certain differences, but at the end of the day, there's something common to all, our humanity. And nobody wants to give up their humanity because of either poverty or skin color or lack of education. And once we respect that humanity, we should all try to understand each other, try to understand each other's culture, so that whatever we develop is kind of laced with the cultural beliefs, especially those that are effective for them to do what is intended. You develop the message based on their cultural belief. And some, especially those cultural beliefs that are very health promoting, those cultural beliefs that are not, you explain to them why it's not. Don't just say this is wrong, explain why it is wrong. Because if somebody has been doing this all through their lives and now they get to a situation wherein you say, oh, what you've been doing all through your life is wrong, then you have to explain why in a respectful way. Because this is a journey that, life is a journey that we have a lot of people on this journey coming from different backgrounds. The more we take time to understand each other, the better will be our work, our job, our profession, and the better it will be also for the people we serve. And we should, as health profession, try as best as possible to refrain from degrading or demeaning other cultures. Because for them, that is their belief. You can explain to them, you reach them where they are and bring them to where you want them to be. It's always the best way. Don't start up front by condemning, by degrading, by humiliating. You start with respect. Okay, accept this, but this leads to this. Is that what you want? No. Then let's try this and see where we get, and see where we go from here. Drinking alcohol in excess. You don't just say it's bad. I know, okay, but drinking alcohol in excess leads to abuse, violence in the family, leads to Liver problems leads to sudden death. But if you curtail drinking alcohol in excess, this will reduce violence in the family. This will reduce destruction of the liver. This will give you a longer life. Which one do you, You say, because at times it takes time to change people's attitudes, but it's all for the better if you walk with them in a respectful manner, in a committed manner, in a manner in which they understand you and you understand. There is an open dialogue. There is trust between you and them for them to be able to improve their health. Because even right now, there is a big challenge with the COVID vaccination. Certain cultural beliefs in certain denominations or certain religious beliefs are saying, no, we're not going for the vaccination. And you have to be able to try. First of all, try to know why they say they are not taking the vaccination. And try to explain to them why it is important for them to take the vaccination at a very human level, for your own good, for the good of your immediate family, for your community, the state, and the world. Please take the vaccination. You see, because some of the stereotypes, some of the miscommunication that has been yes, promoted through social media is false. It's false. And some of it, most of it, they try to go through people's cultural belief system, because it's always easy for me to convince you. I have to use your culture to explain. It's much easier. But at the end, it's to your own demise. So please, as young people, don't fall for all this social media miscommunication about the vaccination. When you have the opportunity to be vaccinated, please take it. It's good for you. It's good for your family. It's good for your classmates. It's good for everybody around you. Don't believe what you hear or what you read on the internet or the social media, because you have some people who just want to create a situation wherein down the road, you don't take it, you get infected, you die. They are really not seeking your interest. They are just convincing you to engage in something that will kill you. The less you people like you are around, the better. The better for them. So please, please, when your time comes for the vaccination, take it. Encourage family members to take it so that we try as best as possible to do away with the destruction of this virus. Okay, we are now going to end the lecture here. Please take time to read this chapter, this community and public health ethnic populations, because some of these things can explain a lot of things to you, why you see what goes on in this country, the gaps that leads to this mistrust and unnecessary violence or just uneasiness that goes on in the country. Take care.